Hello, you're welcome to Medic Echoes Corner, and today we bring you yet another wonderful, insightful, and educative video regarding your health. Today we'll be talking about a very important topic, and it's going to be depression. We'll talk about depression today. What is depression? Depression is a mood disorder, and by that it is a clinical disorder characterized by a depressive mood, depressed mood, lack of interest in previously pleasurable activities, loss of energy, also characterized by a feeling of worthlessness, and could go down to suicidal thoughts and so on. Now, while it's normal that at a point in a human's life, as a response to situations around, one could have a low mood or could lose interest, that is not depression. Depression is a clinical disorder, and so the WHO has said that over 264 million people have been affected. 264 million people affected, most of them being females than males, and because of the fact that it does not really present with physical symptoms like fever, cough, and diarrhea. It rather presents with issues of thought, issues of feeling, and issues of behavior. That actually makes it hard to get to know those who are affected.
Let's look at causes of depression. The exact cause of depression is not known. However, there are social, environmental, and genetic causes of depression. Genetic causes. Studies have shown that first-degree relatives of every depressed person are 3 times at risk of coming down with depression. Studies have also shown that second twins of every depressed twin have 50% chance of coming down with depression. Environmental factors. These include childhood trauma, physical, sexual, and emotional abuse, and childhood neglect. Social factors. These include social isolation. These are people who don't mingle with others. Probably they don't have relations or relationships where they can go and express themselves. Other causes include frequent academic failures or an unexpected failure in an exam. We also have unemployment. Studies have also shown that people who are unemployed or who lost their job are also 3 times more of coming down with depression. We have heartbreaks and breakups, divorce, alcohol abuse. Alcohol is the most depressed drug that is being abused worldwide today. There are loss of dear ones. They also cause depression. Chronic illnesses that have stayed for long. Then recently, we have increased indices in rape and infidelity in marriage. Therefore, watch out for yourself. Watch out for yourself.
Symptoms of depression, some of them have transiently been mentioned. They include problems with sleep. This can come in form of difficulty sleeping or oversleeping. There's usually a problem with appetite. There's what we call comfort eating. You see them eating often and all too frequently. There may also be decreased libido, decreased sexual drive or lack of sexual drive. There may also be difficulty concentrating, difficulty remembering things. They are difficult to get along with. Also, people with depression may have loss of interest in previously pleasurable activity. There may be low motivation or even no motivation at all. There may be feeling of worthlessness, hopelessness, anger, and irritability. The other symptoms of depression include a feeling or thought of self-harm or suicidal thoughts, might even lead some of them to committing suicide. Depression drains your energy and leave you empty. Most people with depression lack the strength to seek help, but it shouldn't be so. If you are having the aforementioned symptoms of depression, what you need to do is to consult with your doctor, who will ask you questions, talk to you, and use certain depression screening tools such as the Beck's Depression Inventory, Patient Health Questionnaires, and a lot more other screening tools to assess whether you are depressed or not. And based on your score, you can either be mildly depressed, moderately depressed, or have severe depression. And treatment modalities are targeted based on this characterization of depression. For treatment, basically it can either be pharmacotherapy or psychotherapy. For pharmacotherapy, it's mainly the use of medications, drugs to treat depression, while psychotherapy involves cognitive therapy, behavioral therapy, interpersonal psychotherapy. You also have the self-control therapy. And there are a lot more. So depending on your characterization of depression, mild, moderate or severe, any of these treatment modality can be explored. However, for people that are mildly depressed, psychotherapy alone is enough to take care of the symptoms and they can recover fully well with psychotherapy alone. However, for people with moderate to severe depression, they might require a combination of psychotherapy and pharmacotherapy to achieve treatment. But one thing you need to know is that depression, whether mild, moderate or severe, are treatable and curable. However, the treatment modality has to be tailored to the patient's need and patient's ability to tolerate, and depending on also on the severity score. However, treatment for psychotherapy is all-encompassing and generally involves a lot of specialty, not just the behavioral scientists, also involve family, relations, friends, and the like.
How to get help in depression? I have some points that will help you in depression or help you avoid going into depression. Number one, reach out and stay connected to people. At this point, the people you stay with is very important. Stay with people that will build and encourage you. Don't stay with an idiot that will take advantage of your condition and make you feel like a disadvantage. Number two, do things that make you feel happy. Do things that make you feel good. It could be your hobbies, it could be singing, it could be dancing, it could be eating ice cream. Whatsoever it is, just do it. Number three, exercise. Exercise is a strong depression fighter. It could be dancing exercise, it could be swimming exercise, it could be jogging exercise. Number four, expose yourself to a daily dose of sunlight, because sunlight improves an activity hormone called serotonin, which increases your mood. Number five, eat healthy food, eat balanced diet. Number six, change negative thinking. At this point, avoid naysayers, avoid gainsayers. Stay in a positive environment. Number six, pray. Now, this is the point where you may not have the ability to pray, but stay with people that are praying for you, because their prayer will make you pray.